Let's move on to some of the dermatologic procedures which are classified under this medicine section. Firstly, we have this PDT, which is photodynamic therapy. This therapy involves the application of photosensitizers to pre-malignant lesions like actinic keratosis. So the session would be done and it is coded on a per day basis. Sometimes if the physician is going to do a curatement or a pre-treatment to these actinic keratosis and then the PDT, we have separate codes accordingly. So you should also report the photosensitizers with the aid of a J code. So we also resort to actinotherapy, which is an application of ultraviolet radiations for the treatment of skin lesions. With the photochemotherapy, we can also treat for psoriasis. So what happens is a chemical substance and is inducing this light, we can also treat the inflammatory skin disorders. When we are also using light, we can also make use of a laser for the treatment of psoriasis. So you will have to know the square centimeter of the skin lesions that are being treated. Accordingly, we'll have to report the add-on codes. Coming to this wound care, we have this active wound care debridement codes here. So here you should understand, we also have this debridement in the surgical part of the CPT manual. But here what happens, we are finding the same debridement codes, but the debridement here is limited to the epidermis and the dermis. Whereas in the surgical section, we saw debridement was from the subcutaneous region, from the superficial fascia, the muscle and the bone. So these are all classified as a non-surgical debridement, where the physician debrides or removes the devitalized tissue like fibrin and the biofilms from the epidermis and the dermis level. So here the code selection is the same way as that of the surgical CPT codes, depending on the square centimeter of the wound that is being debrided. Next comes the wound vac codes. So here it is a negative pressure wound vacuum therapy. What happens here is, when a negative pressure is created in the wound tends to heal faster. So the physician applies a wound vac and thereby creates a negative pressure that aids in the healing of the wound. Here again, you should understand the coding is based on the square centimeter and this would be from 50 square centimeter. So here you should understand whether the wound vac bag which is being applied, is it of a DME type or a non-DME type. So if there is no documentation anything of a durable medical equipment, you will have to go with the non-DME type, which is 97607 and a 97608.